Hello, good evening, and welcome to our Sickle Cell Awareness Month, a 26 days challenge. And today, in our day 5, we'll be considering diagnosis and screening for sickle cell disease. And we all know that sickle cell disease is a disease of the blood, most especially the red blood cells, which are responsible for carrying oxygen. It mostly affects the hemoglobin. So, early diagnosis of sickle cell disease is critical for prevention and care. And screening helps us to detect the disease or even the carrier status before any complication even occur. So, somebody may be looking at this picture and be wondering what is happening here. This is a newborn undergoing genotype testing few days after it was born. So, why newborn testing in the first place? So, this newborn testing is done within few days after birth, as I said, and it involves a drop of blood gotten from the heel are tested and detected sickle cell. It used to detect sickle cell or the threat or even normal hemoglobin. So, if it detects this sickle cell or this normal hemoglobin, it helps health workers to plan out medication and vaccine for the newborn. So when the newborn is detected, what is given is penicillin to be able to boost the immune system of the newborn. So genotype testing now. Genotype testing is usually involved the testing of the blood and to check for the particular type of hemoglobin found in the blood. So during genotype testing, some of the possible results we have are AA, which is a normal hemoglobin, AS, which is a carrier threat, and SS, the sickle cell disease. And we also have other variants such as the SC and AC, of which I said we'll talk about it, and we're going to do that in our subsequent episodes. So this is important before marriage and family planning, so as to help couples or people intending to marry choose wisely. So hemoglobin electrophoresis. What is hemoglobin electrophoresis? It's an advanced blood testing and it identifies the exact type of hemoglobin present, and it is used to confirm diagnosis if a person has normal hemoglobin or it carries the threat or has even sickle cell disease itself. So prenatal testing. What happened during prenatal testing? Somebody may wonder, is there any can we test a baby? Can you check for baby blood even when it's still in the mother's womb? Yes. This involves getting the blood from the mother's bloodstream because of fetal blood from the blood is gotten from the mother. It helps us to check for what does the fetus have. Does it have normal hemoglobin? Does he have sickle cell threat, or does he have sickle cell disease itself? So this is done during pregnancy and it detects unborn child having inherited sickle cell, which help family prepare early. As I said, this gives health workers an insight if the baby is born with sickle cell anemia, so they can start giving antibiotic to boost the immunity of this fetus. What are some of those antibiotics? They are penicillin, which are being given, and also for close monitoring of the baby immediately after birth. So the next one in the diagnosis is fingerprint. Somebody is surprised fingerprint. I thought it's just meant for crime scene and all. No, fingerprint has found to be very valuable when it comes to genetic disease. As we all know, sickle cell is a disease of the blood, which is also known to be also a genetic disorder of the blood. So what happened here is this is still a working hypothesis, though it has not been fully approved yet to be a diagnostic tool, but with emerging researches and findings, we believe that in a couple of years it can be a promising diagnostic tool for sickle cell anemia and other genetic diseases in places where people don't have access to electrophoresis tests or even prenatal testing and even testing after the baby is being born. So this can serve as an emerging tool which help us to screen further. It is not necessarily, it does not mean it is a test itself, but it can give us an insight so that we know who can go for further screening to check their genotype if they have sickle cell disease, or they have normal hemoglobin, or they carry the sickle cell trait. So why does this even matter? Why does diagnostic and testing even matter in the first place? Because many regions lack routine for newborn screening. From the picture we saw earlier, the newborn baby going 3 days after birth. Some of the babies in third world countries are born at home, so they don't have access to this newborn screening that is done. And the only time maybe parents know about their child being sickle is when he experiences first or her first crisis. So knowing your genotype help us is equal to making informed decision. So it's very important. If you haven't know your genotype today, this is a challenge for you to go know your genotype, so as you make informed decision. As if a saying goes, if you are not informed, you are misinformed. So early detection is equal to better care and longer life. So the reason why detection, this testing is done is to detect this disease early, to have a better care. As I said, for newborns, it helps health workers to know what to give to build the baby immunity, such as penicillin, and this can help to increase the lifespan of people living with sickle cell anemia just by healthy detection. So awareness saves life. It's very important for us to be aware. That is why I started this series, to create this awareness about sickle cell disease and what it really is. So what are the key takeaways from today's series I want you to take home with you is diagnosis and screening are powerful too, but they do not cure sickle cell disease, but they change everything. I used to, but they do not cure sickle cell disease, but they change everything. How do they change everything? Their testing can help you plan your marriage and even family planning, so as you know who to marry. If you watch our second episode, we're able to do some crossing of the AA and the SS and try to see what will be the genotype of their children when they give birth to them. So in the end of this video, I'm going to put you're going to see a pop-up on your screen with the day 2, showing you the day 2 of the series, so that you can watch to know your genotype, which one is compatible for you to marry. So know your genotype. As I said, if you haven't know your genotype, go to a medically certified laboratory and get tested to know your genotype today. So get tested early, so as you know your genotype, if you are sickle cell, so that it can enable you for early, as I say, early detection equals to early treatment and longer life. So awareness leads to prevention and care. So if you are aware, it leads to the prevention of you falling a victim and ending up having children living with sickle cell anemia, of which you want to reduce the prevalent value both globally, nationally, and even locally in wherever you are. And to do this, it all starts with you making the informed decision. So this is just a wrap up of today's session. I remain your host, Tamu Ukwai. Join us tomorrow again as we discuss a wonderful segment in this 26 days awareness. And to everyone living with sickle cell anemia, all I have to say is you are a warrior.